If you're having trouble having a baby, there is a procedure that could give you hope, especially for women over 40 or women who've had a string of miscarriages. Kristen Hartman is here to explain that. Kristen.
Hi, Rob. We're talking about an advance that could make in vitro fertilization more efficient. Doctors at the fertility centers of Illinois say more than 100 women have taken advantage of the technique so far. We're told the little guy you're about to meet is the first living, breathing result right here in Chicago.
Yeah, talk to Mama.
Henry here was a labor of love, one some might call a miracle of science. We spoke with his proud mom, Kathleen Hayes.
He is kind of a first in the city of Chicago.
He is, yep.
How so?
He came about through a pre-genetic diagnostic test called CGH.
That's a genetic screening technique. To learn more, we went where Hayes went, the fertility centers of Illinois.
This is novel.
How is it novel? I mean, because if it's been around for 10 years, what's different?
Similar to most technology, it keeps getting better and evolving.
Dr. Brian Kaplan says in the very recent old days, doctors could measure only 12 of 23 pairs of chromosomes when they gave embryos a once-over before in vitro fertilization.
So you were kind of flying blind on those other chromosomes, is what? And so if there was a deficiency in those other chromosomes,
You would miss it.
You would miss it,
That's
and
right.
you ran the risk of miscarriage.
Of miscarriage or an abnormal baby.
Now, when they extract an embryonic cell, they can look at all 23 chromosomes. Kaplan says doing that allows them to select the best embryos for IVF transfer.
It gives you more comfort in that the chance of that embryo implanting would be higher.
That brings us back to Henry and his mom.
Show Mommy your fist.
She's in what you might consider a target group for CGH. Over 40, she was producing healthy embryos, but in vitro wasn't taking until more thorough screening.
It found the egg that would implant and stay.
Yeah, definitely.
Did it also give you peace of mind that he was going to be healthy?
You get as much reassurance as you can that that the embryo that's going to be transferred into you, or the embryos that are going to be transferred into you, are chromosomally normal.
What is the payoff?
The payoff is that I get to be a mom.
Pre-implantation genetics is not without its moral critics. When you're selecting, you're also rejecting human cells. Right to Life advocates have a problem with that. The doctor says decisions are up to the patients. The mom we met acknowledges there's a debate, but it's one she didn't want to discuss, Rob.
So, Kristen, what is the cost for something like this?
About $5,000.
$5,000.
For just that advance.
Okay.
Just that advance,
All right.
on top of in vitro.
All right, thanks.